Public health officials in Boston are meeting right now to try to decide whether or not to drop that city's indoor mask mandate for schools and businesses. Here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
You too.
All right, Dr. Ellerin, Boston has its own COVID-19 dashboard, as you're well aware, so we can look at the same data that the city is actually using to make this decision. So in your opinion, which numbers are the most important? Is it hospitalizations, which is pretty much what we've kind of deduced from what the state has done?
Right, Ben. Well, I think really all of those numbers are important. You're looking at number of cases. That's very important as an early indicator, just like wastewater is. When you want to look at hospitalizations, of course, that may be the most important, but it tends to be a later indicator. So I think, it depends. If you're talking about schools and trying to decrease spread, you want to look at percentage cases or the case count rise. If you're looking at, ICU capacity and the ability for hospitals to take care of patients, then of course, percentage of hospitalizations are important. Both are.
So, Doctor, we expect the Boston Public Health Commission to make a decision today. If you had a vote, what would you choose? Masks or no masks?
Well, the good news, Maria, is we know that they are going in the right direction. So likely they'll be able to disband with the mask mandate. If not today, then likely soon over the next few weeks. But, there was a great article written in the Globe just a couple of days ago called The Great Divide by Jenna Russell. And what she talked about is that she highlighted that students may really be going through a challenging transition, going from masking over the past, more than 2 years now to basically taking their masks off. So I think the important part is to remember individuals, if they want to remain masked, they should be. Vulnerable kids, vulnerable adults. If you live with someone who's vulnerable, you want to be able to wear masks without judgment. So I think we have to approach this with grace, with compassion, and just know that it's not easy. We've told our kids for the past 2 years, you want to keep your mask on to protect other vulnerable children in your class. So now we're saying it's okay to take off the mask. I do think it's okay, but I think this is a really, it's a transition. It's going to take time.
That's a good point. It's one of the points that our superintendent actually made, that you got to respect everybody's personal decision, because that's what it is. It's mask optional. It doesn't mean that masks are necessarily gone for good either. So as you know, Dr. Ellerin, Boston is a diverse city, 700,000 people. Should one COVID policy apply to the whole city, or should there be different policies for different neighborhoods, or is that too complex?
As my partner, Dr. Wild, said last week, the best care is the care that's local. Right? We can hear what the CDC says. We can listen to what the Department of Public Health in Massachusetts say. They're very wise. They give good advice. But most importantly, it's what's happening in your community. You may be at a community around Boston where your percentage cases are at 8% still, even though overall in Boston, you're down to 2.4%. If you're in one of those communities that's been harder hit or continuing to get hit with cases, it may make sense to continue masking for a little longer. So I think you do want to just know your local, what's going on locally where you live.
Dr. Todd Ellerin from South Shore Health. Thank you as always, Doctor. We appreciate your time and the things you have to say.
Thank you.
Be well.